Good morning. This is Jessica Stone, Community Relations Director for Mitchell County Hospital. Thank you for joining us for our first episode of Ask the Experts. Keep those COVID-19 questions coming. Every Thursday morning, we will select a couple of questions to answer. Questions can be submitted on Facebook or by emailing jnstone@mitchellcountyhospital.com. Joining me this morning is Dr. Dee Roach and Jennifer Hale with Infection Control. The first question is for Dr. Roach. Can you get COVID-19 twice?
That's actually a pretty challenging question. In a perfect world, the answer should be no. Once we're introduced to the virus, our immune system mounts a response and produces an antibody to that virus. And that antibody should be, again, in a perfect world, present for a number of months to years in some instances. With this particular novel coronavirus, however, we're seeing that in some instances that robust immune response is not occurring, and so people are in fact, again, not in all instances, but in some instances are in fact susceptible to reinfection with the virus. Again, in a perfect world, the answer would be no, but realistically, I think there is an outside chance that you could be reinfected with it.
Thank you, Dr. Roach. Jennifer, the next question is for you. With businesses slowly opening back up, how can you protect yourself in public?
We've stayed at home. We've done what they've asked us to do, what CDC has recommended, and now we're reopening. So I want everybody to enter into this very cautiously, and just be aware of your surroundings. And while you're out and about, like say you go to the grocery store or the bank, if you can have a bottle of hand sanitizer with you, and after you touch money or touch your card or touch the shopping cart handle, then use that hand sanitizer in between. If you can wash your hands for 20 seconds with soap and water, that's more recommended and a better way to defend yourself. Wear a mask in public. You'll probably see a lot of people choosing not to wear the mask, and that is going to be their choice. It's the CDC recommendation that we all wear a cloth covering of some sort while we're out in public. If you are sick, please stay home. And contact your medical provider if you need to see a doctor. Again, just entering back into things cautiously as possible, trying to do the social distancing as best we can. If you know a certain time, like at the grocery store, probably certain times are going to be more crowded than others, so you can plan that accordingly and plan your trips accordingly to be there when there's less people. That would be a great idea. Anytime you can do a touchless payment, that's great. They have all different kinds of ways to do that now with like the Apple Pay and things like that. So if you can do a credit card by phone or something, that's a touchless payment. So that's a great way to do that. And then just really do the hand sanitizer, wash your hands, social distance. Don't go out if you're sick. Monitor your symptoms at home and reach out to the clinic if you need an appointment.
Thank you, Jennifer. Dr. Roach, is it possible to get COVID-19 and the seasonal flu at the same time?
Absolutely is. These are obviously different viruses, and they can certainly infect you simultaneously. One of the concerns, in fact, with reopening our economy is that there is predicted a second surge or a second peak to the occurrence of the coronavirus. We don't know if or when that might happen, but certainly some of the people at CDC are concerned that this second peak may actually coincide with our seasonal flu exposure, which would certainly challenge the resources of our healthcare facilities. So absolutely, yes, you can.
Thank you. And lastly, Dr. Roach, what is the best way to test for COVID-19?
Again, a very challenging question, thank you. There are obviously a number of different ways to test for coronavirus infection. The most reliable would be, of course, using antibody detection. Whenever we're infected with a virus, our body reacts with what we call an immune response, and we produce antibodies to that particular pathogen. There are two primary immunoglobulins that respond to this infection. The acute phase reactant is called immunoglobulin M, and it's an indicator of acute or active infection at that time. Once you're exposed to the virus, the second antibody is called IgG. It's an indicator that you have at least been exposed to it or have had the infection at some point in the past. In my mind, the perfect world is to be able to identify both of those antibodies simultaneously, so you can determine if you are, number one, are you acutely ill with the infection, and number two, have you actually had exposure to or had the infection in the past, which would be particularly helpful in diagnosing those people who have had minimal symptoms or no symptoms, yet still have positive tests for it.
Thank you. And thank you everyone for joining us this morning. Please remember, if you have any questions that you would like our experts to answer, remember knowledge is power. And we will be doing this every week. So remember, you can submit your questions through Facebook. Just leave your comment in the comment section underneath our post, or please email jnstone@mitchellcountyhospital.com.